After researching and writing the paper, would you describe yourself as a stem cell skeptic?
So I sit on the ethics committee for the North American Spine Society, and the CEO of our society approached me about writing a combined piece between the two of us on what is going on in the world of stem cells. I can tell you as a physician, patients ask about stem cells almost every day, if not every week. From an ethics standpoint, we wanted to cover, what is the current landscape that's going on right now, both the pros and the cons, and we tried to keep it, really from a neutral position of here's what's out there and here's what the data shows. Stem cells are being used for spinal cord injuries and for things like ALS, and I think those things are very promising, particularly something like ALS, which is, universally fatal and catastrophic in its process. I think we need to speed those along further. But at the same time, we also have to be cautious, and we have to make sure that the people who are doing it are using meticulous technique when they're doing it. So sterile technique, making sure that the cells are handled properly, also at the same time giving people realistic expectations. Dr. Adelson runs a really good practice. I watched him do spinal injections, so facet injections, and I have to say his sterile technique was what I would expect of myself in an operating room. His ability to understand the anatomy, the 3D anatomy, looking at a fluoroscan, which is a live x-ray scan, was, I teach people how to do injections, and on that day, I was impressed with what I saw that he did. I truly believe patients are consumers, and patients should have the right to choose safe treatments. I've sent patients who had, degenerative discs to him or facet degenerative problems to him. I've sent physicians to him who were patients and friends. Again, because having watched him, I feel like he knows when to do things and when to hold back. Those are the things that I look for in a good clinician.